So, Karen, the history I just took from you tells me that you've been in pain for quite a long time.
Yes.
And this has been a huge suffering for you.
Yes.
In fact, it has changed your entire life.
Mm-hmm.
It also sounds like most of the things you have tried, which have been things like injections and medications, have made only a small difference at best.
Absolutely.
Okay. Now, when we took the history, you used some describers of your pain, like you said you have back pain shooting down the leg,
Mm-hmm.
but you also at one time said your pain was overwhelming,
Mm-hmm.
and that's I think you used the word inescapable, that you
Yes.
could not escape the pain. So that tells me that you're suffering in a couple different ways. One, there is the physical pain, and the other is the internal suffering that has changed who you are as a person. Does that seem right to you?
Yes.
So I'd like to think about whether you'd like to employ a new approach. Would you be willing to sort of try something different that I found to be very effective with some of my other patients who have chronic pain?
Such as?
There's something called cognitive behavioral therapy. That's a way to address the suffering parts of your pain, which, correct me if I'm wrong, I don't think anyone has directly addressed up until now.
No. I didn't
Okay.
know there was a difference.
There is a difference, and it's important to recognize that, otherwise we sort of stay stuck in trying to treat one thing, and the result is your pain doesn't really change. So this does require a referral to a behaviorist, a type of psychologist, who works with you on a very regular basis and provides you with homework to try to understand some of the thoughts you have about your pain and how that has come to be such an inescapable thing for you.
I've seen a psychologist in the past. I went for a visit,
Okay?
and
How was that?
it was an hour long,
Mhm.
and I walked out feeling frustrated.
Well, I'm sorry that had that element of frustration for you. Cognitive behavioral therapy is a very specific kind of psychotherapy that involves you having homework to do between the visits. Did you have any homework when you saw the psychologist?
No.
Okay. So I would guess you didn't try cognitive behavioral therapy. And it's very important to understand that many psychologists exist with many different types of approaches, but only cognitive behavioral therapy is going to provide you with a new skill set. And only cognitive behavioral therapy has been shown to be effective in people who have chronic pain. The patients I have referred with chronic pain to this particular therapist have done extremely well. And I am here to recommend to you that we consider embarking on this new approach. What do you think?
How many visits?
Well, I'd like to start with 4 visits and see how you do, and then see you back in follow-up and see if you feel that you're making progress. It is a week by week. Think of it as a training course where the psychologist gives you work to do in between and allows you to make progress over time. Would you be willing to consider 4 visits?
Okay. Yeah.
Good. Well, I'm very pleased. I think you'll find this very beneficial for you.
Okay.
So let's make the appointments, and I will see you back after those appointments have happened and see what your response is.
Okay.
Wonderful.
Thank you.
You're welcome.